Now it is time to hear from our first speaker, Dr. Dea. Before introducing Dr. Dea, I just want to remind you to drop your questions at the chat box for any of the speakers, and during the two Q&A moments that will occur, we will take a look at those questions. Well, Dr. Dea is a medical education and research specialist at Tbilisi Medical Academy in Georgia, coordinating the integration of Body Interact throughout the sixth-year medical education program. Dr. Dea is specializing in the field of medical education and focusing on the practical application and impact evaluation of innovative technologies in education, underground medical studies. Welcome, Dr. Dea.
Good afternoon, everyone. Thank you, Daniela, for this kind and warm introduction. I would first like to express my gratitude to the Body Interact team, Mr. Pedro, and of course you, Daniela, for having me as a speaker, and greetings to my fellow speakers. I will share my screen. Hello, everyone. Again, my name is Dea Goderdzishvili. I'm a medical education and research specialist at Tbilisi Medical Academy. And today I would like to share with you our journey using Body Interact as a tool for clinical reasoning development, as well as my personal experience going from a student using Body Interact in my own university studies to being an educator, integrating it into our clinical curriculum. So a bit of background about me. I promise I won't keep this too long. I graduated from Tbilisi Medical University in 2021, and I was first introduced to the Body Interact platform in my fifth academic year of studies, because due to the pandemic, we had to find new solutions for patient interactions because hospital trainings were inaccessible at that time. And along with my everyday teachings, we used Body Interact as part of our objective structured clinical examination, also known as the OSCE examinations. Now, moving forward, in the fall of 2021, I joined Tbilisi Medical Academy, and since then I have coordinated the integration of Body Interact into our TMA curriculum. I have facilitated the faculty and student orientation sessions on how to use Body Interact, and have continuously monitored and evaluated our integration process. So what I've learned going from a student to an educator from this transition is that it helped me preemptively identify some of the challenges students may face when first being introduced to the Body Interact system, and how to find solutions to those concerns. So for example, a very common concern would be, I have completed this case successfully, yet my global scores are very low. Well, that is my opportunity to introduce to them the first, second, and third priority characterizations and categorizations, and to explain to them how the platform works. I've also learned how to focus on the main learning objectives and goals of Body Interact, how to offer assistance and guidance to students and faculty, share some tips and tricks, and of course, how to work with the TMA faculty on wider applications of the Body Interact platform into our teaching processes. And speaking of, this is our journey at TMA and how we have implemented the Body Interact. So since 2021, Tbilisi Medical Academy has been implementing BI as a tool for clinical reasoning development in four major ways. First, it's the everyday teachings. This is our most common form. Then we have integrated BI into our examination processes, most commonly into our midterm examinations. Recently, we have also included Body Interact into our research line and into our research projects. And finally, we will introduce Body Interact to second-year students as an early clinical exposure. I will briefly touch upon all of these four categories. So let's begin with our everyday teachings. So Body Interact has been introduced to the fourth, fifth, and sixth year medical students, both in the Georgian and English education programs. And we use Body Interact as a tool not only for patient communication and patient interactions, but also for critical reasoning development and to inspire group discussions and debates among students. What you see below is a simple or a little formula we observe when new students are introduced to virtual simulators, because what starts as initial confusion as to what is a virtual simulator and what is Body Interact soon turns into curiosity, which transitions into a friendly competition to see who can get better scores, who can solve the case better. And of course, all of these factors contribute to the end goal, which is a strive for academic success. Here are our simple statistics of our current spring semester of 2022. So we have introduced BI in a total group of 10 groups, and a total of 138 students. But for our future goals, we want to have a broader application of the virtual platforms and hopefully integrate these virtual simulators into our syllabi. Down below is a simple graph that represents the global score results of 24 students of the 12th semester who have all completed the same case, which is case 168. And what we see in this graph is that even though the average score was 65%, we see that the range is from 20% to 88%. And I think this is fascinating to observe how each student adapts to virtual simulator, in this case, Body Interact, very subjectively and very individually. And I think it's very interesting to observe the versatility of these results. In terms of using Body Interact into our examinations, select cases are employed specifically for our midterm examination purposes, and this method allows us to see how well students can incorporate their theoretical knowledge and apply it to the practical application. There's also a possibility to utilize Body Interact in OSCEs at TMA, because I have also personally have completed BI in OSCEs in my final year. Again, this is a very simple graph that represents the average results of 12 students who have completed Body Interact as their internal medicine midterm exam. And these are the 8th semester students. And how our examination process works is that whatever the students receive as their global scores are reflected as their midterm mark. So if a student receives from 70 to 80%, that is equal as C mark in their midterms. From 80 to 90 is a B, and then from 90 to 100%, that is an A, and so on and so forth. Next, this is our BI integration into our research line and into our research projects. So this was recently piloted among the 6th year, the final year students. And what we did was we assigned 2 Body Interact cases the students had to complete. Based on these 2 exact cases, they had to write 2 case reports. They had to formulate PICO method questions and Mythbuster questions. And having this new method gave us the ability to observe how well the students can diagnose the patients, how well they can identify key features of unique conditions, and if they can construct well thought out further plans of actions. And highlighted in green and yellow are 2 results of highlighted in green are the average global scores and case report scores of 17 students who have completed case 273. And then on the right, we have in yellow, we have the 9 students who have completed case number 4. And these results, if you follow along, these results reflect how similarly both the Body Interact platform and the conventional assessment system have evaluated these students. So on the right, we see that the global score averages are 74.2, while the case report averages are 72.5. So they're very similar in evaluation, which was, again, very interesting to observe. And finally, we are very excited to introduce Body Interact into our experimental trial with our 4th semester students. Again, these are 2nd year students who are still studying the basic disciplines of medicine. And after these students complete integrated cases, after having real-life patient interactions and having team-based discussions on specific medical topics, they'll have the opportunity to observe these medical topics come alive in virtual simulators. And we believe that introducing Body Interact as an early clinical exposure will not only reinforce the knowledge of basic medical disciplines that they're currently studying, but it will also build a foundation for a higher level of clinical reasoning for the upcoming years. Lastly, I would like to share reflections, some of the lessons we learned, some of the advantages of using Body Interact, as well as some of the challenges we have faced. So what we have learned is that Body Interact is a beneficial tool for clinical reasoning development. However, successful implementation, of course, requires proper organization, monitoring, and enthusiasm, not only from the students, but from the faculty side as well. The advantages of using Body Interact has opened very unique teaching opportunities at TMA. Again, for our examination purposes, for our research line purposes. And Body Interact has also inspired valuable debates among students and guidance from educators. But yet again, with positive results, there are some challenges that we have faced, most commonly being that conservative and traditionalist educators often question and doubt new medical innovations and medical advancements, but that's our chance to explain to them these new methods and these new education curricula. And of course, student motivation is the key to successful implementation. Thank you again for the Body Interact team. At TMA, we strive to assimilate innovative teaching methods to better develop our education curricula and inspire future doctors and medical professionals. And I have been honored to share my personal experience using Body Interact, going from a student to an educator, as well as our journey using Body Interact platform at Tbilisi Medical Academy. So thank you again to the Body Interact team and to Daniela.